Good afternoon. Today is Tuesday, January 19th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me again today is Diane Oldenburg, Senior Public Health Educator for the County Health Department. I'm happy to report that the County Health Department finally received enough vaccine to hold its first large-scale vaccination clinic. This past Saturday, the Health Department vaccinated 961 people at the G. Ray Bodley High School in Fulton. The clinic ran very smoothly and was well organized. I congratulate Public Health Director Jin Chang Wang for his team's outstanding work. County staff from several other departments, volunteers, and the Fulton School District all worked together to make this happen. I want to thank everyone who helped in this effort. This clinic was the culmination of years of hard work by our public health team. They have been practicing mass vaccination plans for a decade, and they are finally able to put their planning into action. By the end of today, the County Health Department will have vaccinated 1,376 residents. We estimate that 4,000 county residents have received the first dose of vaccine through the Health Department and our other community health care partners. Some will start to receive their second dose later this week. Many county agencies are working together to get senior citizens, first responders, and frontline workers vaccinated as soon as possible. There are no walk-ins, and no one will be vaccinated without an appointment. People can go through the state website at mieligible.covid19vaccine.health.newyork.gov to learn if they are eligible, or they can call the New York State Vaccination Hotline at 1-833-NYS-4VAX. It's also 1-833-697-4829. The Oswego County Office for the Aging is helping to sign up senior citizens who don't use the internet when appointments are available. Those aged 65 and older can call the office on weekdays at 315-349-3484 for assistance. Today, I also want to clear up some false information that has been circulating on social media regarding the COVID vaccination clinics. The county is not making money off the clinics or profiting from the public's misfortune. Although the Office for the Aging is helping eligible seniors sign up for the vaccine, and their staff has been a huge support in helping to run them, the vaccination clinics are operated by the Oswego County Health Department. We receive the vaccine at no cost, so we do not bill for it. We can bill insurance companies for administrative costs only, so that we recoup that expense for our taxpayers. This is standard practice for all our vaccination clinics when state or federally funded vaccine is used. If a person has no health insurance to cover the administrative fee, we don't charge an administrative fee. Our priority is to protect our residents and increase public immunity. In November, the county legislature approved a very important resolution to accept a $304,948 grant to support the county's COVID-19 response measures. The purpose of the grant, which was clearly stated in the resolution, is to help the county health department with COVID tracking and contact tracing. The grant funds allowed the health department to hire more people to work as public health investigators until June 2022. We have now lost 69 community residents to this virus. With COVID's rampant spread in our county and more than 500 new cases reported in the past week, investigation and contact tracing are critical. To insinuate that the county government is trying to profit from the public's misfortune by charging an administrative fee for the vaccine is shameful and disingenuous. And now Diane will share more information about virus activity in Oswego County.
Thank you, Chairman Weatherup. The data from the New York State Department of Health shows that the COVID-19 infection rate is slowly declining in Oswego County. As of yesterday, the 7-day positivity rate was 7.8%. That is still much higher than we would like. Our county health department is currently monitoring more than 1,000 county residents with active COVID virus, and more than 1,500 residents are in mandatory isolation or quarantine. As of this afternoon, we've had 122,854 tests completed in Oswego County. We've had a total of 5,168 positive test results returned. We currently have 1,058 active cases of COVID. We've released 4,041 residents from isolation. We have 69 deaths reported related to COVID-19. We've received 115,897 negative test results, and we currently have 1,566 residents in mandatory isolation or quarantine. We are still receiving many questions about the vaccine. It's important to know that both vaccines, which are currently available, the Moderna and the Pfizer, require 2 doses to offer best protection. When people receive the first vaccine, they receive an appointment for their second dose. Both doses need to be from the same manufacturer. Until we know for sure that vaccination protects people from spreading the virus, and until enough people are vaccinated so community immunity can be achieved, everyone needs to wear a mask, continue social distancing, and avoid unnecessary gatherings. We have heard some reports of arm pain and fever after people receive vaccine. Studies indicate that up to 50% of people briefly experience symptoms such as fever, fatigue, headache, chills, or muscle or joint aches. For most people, these symptoms were mild and short-lived. We ask for people to continue to be patient as vaccine is being rolled out to the community. The process of vaccinating those who are currently eligible is going to be a months-long process. We will continue to schedule clinics to vaccinate as we receive shipments of vaccine. Please understand that we are not aware of the amount of vaccine that is being allocated to the county until it is ready to be shipped, so the number of appointments will vary from clinic to clinic. We share your frustration. We continue to publicize new places of public exposure on the Health Department's COVID page, but people should expect that they may be exposed to the virus anytime they are out in public. The Health Department's COVID-19 hotline is open Monday through Friday from 8:30 a.m. to 5 p.m. and Saturdays and Sundays from 9 a.m. to 1 p.m. The number to call is 315-349-3330. Thank you.
Thank you, Diane. Our county health department remains committed to getting vaccine to all eligible residents as quickly as possible. We have a great team. We have the support of our healthcare partners in the community. It will take several months to get everyone vaccinated. Until we reach that goal, we all need to continue to use the tools that we've been using to stop the spread of COVID. Wear a mask, social distance, avoid gatherings, and wash your hands often. Thank you for your patience and for doing your part to prevent the spread of COVID-19.